watching CBS 2 News in high definition.
Also, can an aspirin a day help to keep skin cancer away? The new research linking common painkillers to a lower risk of cancer. So what are doctors saying?
A breakthrough in genetic research could be the first step toward a male birth control pill.
Scientists in Scotland say they've discovered a gene that is crucial to producing sperm.
And researchers say that opens the door to a possible contraceptive pill for men. The effects of such a drug would also be reversible because it would only impact sperm cells at later stages and does not affect the overall ability to produce sperm.
Well, something you most likely have in your medicine cabinet may help to prevent skin cancer.
But before you think about ditching your sunscreen, you better listen to what our Dr. Max Gomez has to say.
We're talking about aspirin and its relatives, ibuprofen, Aleve, and others in the same class called NSAIDs. These drugs have been shown to have an anti-cancer effect for colon, lung, and prostate cancers, but do they work for skin cancer?
I've had skin cancer twice. Once years ago on my back, then again they found more on my neck here.
Unfortunately, that's not all that surprising for a blue-eyed, fair-skinned former sun worshiper. But what if there was something Tara McLaughlin could take to prevent skin cancer? Well, new research in the online version of the journal Cancer finds that common painkillers such as aspirin and other non-steroidal anti-inflammatories may help prevent some forms of skin cancer. Doctors out of Denmark looked at records of nearly 200,000 people from northern Denmark over a 10-year period, noting the prescriptions they filled. They found people who took more than 2 different kinds of this type of painkiller had a decreased risk for developing melanoma compared to those who filled 2 or fewer prescriptions for these medications. The odds were even better if the drugs were taken frequently for 7 or more years. But dermatologists point out that reduction in skin cancer was not that significant for this type of retrospective study.
I think the effect was quite small, maybe 15%, 20% reduction in the skin cancers. So it really wasn't very major at all.
Experts say this type of study needs to show much larger effects before we can attribute the effect of the drugs. Plus, there are many other factors that could have led to the decreased skin cancer risk. And remember our skin cancer patient, Tara McLaughlin? She takes Aleve all the time.
Probably a few times a week. I have a slight headache.
We should not stop using sunscreen based on the findings from this study.
Remember, these are powerful drugs with many beneficial effects, but they can also have serious side effects like stomach bleeding. If you take them for other reasons, maybe they'll prevent some skin cancer. But absolutely keep using your sunscreen. Christine, Maurice?
Okay, Doc, thanks so much.